Well, studio, we welcome to the program now the mayor of Greenwood, Mississippi, Mayor Carolyn McAdams. Good to talk to you again, Mayor. How are you?
Good morning, Gerard. It's great to be here again and talk to y'all. I'm so appreciative that you're still interested in the progress of our hospital.
Yes, indeed. So give us an update on where you are. I know some action has been taken since the last time you and I spoke about the hospital. What's the current status?
Well, the current status is if we're still waiting on the critical access destination. It has been handed over now to the Center for Medicaid and Medicare Services, and I don't know when that decision will be made. Hopefully it will be made before the end of the year, but I'm being told it could be in January, so I'm not sure. So we're still hanging on. The hospital board and the administrators working on every possible avenue to keep this hospital doors open and provide services. And, you know, I think a lot of people think that we're not providing any services, but actually we're providing still a good many services at Greenwood Leflore Hospital. We still have ER, we have OR, we have inpatient, outpatient, cancer care, the wound care, general and vascular surgery, orthopedic surgery, podiatry clinic, the neurologist clinic, cardiology clinic, and the Edabina clinic, which is 8 miles away from Greenwood, has the aftercare service. So there's still services being provided there. Like I said, we're still hanging on by a thread financially, but the county and the city going in together, receiving or getting the line of credit for $10 million, that has been something that at least can ease the mind for the next several months that they have money to pay payroll. And are we making money? The Greenwood Leflore Hospital still is in the black. Even though we offered these services, it's still in the black, and we've cut a lot of services. We've cut a lot of employment there. We've done everything that we can do to provide services to the citizens, but make it more financially secure. So we've done everything we can do. So hopefully we will get the critical access, but the county and the city decided that since we don't want all of our eggs in one basket, so to speak, we did reach out and do an RFP, and that has gone out. It was in the paper, I think, like last week, and it'll be in the paper for an additional 2 more times. And so hopefully somebody might reach out. I don't know. We're working with UMC right now with telehealth care. So maybe that would be a good avenue for people to be able to pull up on their television and see the doctor or whatever their concerns are there. We're also working with Jackson Heart to help us with the cardiology services. So the hospital board and the administration has done their due diligence. They've gone out there and seeking all these possibilities for Greenwood Leflore Hospital. Now,
So
we're
what's
just
the
going to wait on.
RFP? Excuse me, Mayor. What's the RFP for exactly? What are you requesting? What services?
Well, it's to see if someone is interested in buying or leasing the Greenwood
Okay.
Leflore Hospital,
Okay.
just like when UMMC did the
Yeah.
RFP.
Okay. Yeah, and of course they passed. They elected not to acquire the hospital. So you're
Yeah.
seeking a potential buyer, and
Again.
you're okay, and you're conducting that through an RFP, request
Yes,
for
correct.
proposal, essentially. Okay,
Request
all
for
right,
proposal.
understand. All right, so
So,
explain to our audience. So converting the category of care for Greenwood Leflore Hospital means higher reimbursement rates from Medicare and Medicaid, correct?
correct.
Yeah, and that's
With
why you're
with the
seeking
critical
that.
access. Yes,
Yeah,
and that's why that would really help us tremendously. I'm not saying that it's going to solve the problem completely, but it would certainly go a long way in solving the financial issues at the Greenwood Leflore Hospital, for sure.
I believe. Yeah, I believe you've also noted that just overall low reimbursement rates, even from private insurance, for those patients that whose services are reimbursed by private carriers, that's been a problem as well to the hospital. Is that
Correct.
correct? Yeah.
That is correct. And a lot of people that can afford to go outside the city of Greenwood has been doing so. And I think a large part of that is because they don't realize the services, uh, even though we've told the community that we still provide services at Greenwood Leflore Hospital. I think a lot of people, I don't know why, just the priests and, just thinking
Okay.
that, hey, they're not out there, they're not providing the care that's needed. So a lot of people are going outside of Greenwood Leflore to get health care, and that's hurting
Right.
too. So we need
So
people to support the Greenwood Leflore Hospital.
got you. But you've also eliminated some categories of service as well. Is that correct?
That is correct. Yes, that is
Wh-
correct,
which are
unfortunately.
those, like OBGYN, I think? Is that true?
OBGYN, absolutely, and that's a biggie,
Okay.
especially in the Mississippi Delta,
Yeah.
because we do have a lot of birthing of babies, and
Yeah.
so that was a big thing. Now, of course, they can go to Grenada and Jackson and Greenville, but not in
Have
Greenwood.
have there been any staff reductions or any other expense reductions that
Oh,
are
absolutely.
noteworthy?
Absolutely.
Okay.
They've had to close some of the facility down because there was 200, I think it was around 220 beds in the Greenwood Leflore Hospital, and now that's been reduced greatly. So
Okay.
that being said, that was a large, reduction in utilities and maintenance and janitorial services. And then some of those people, unfortunately, were let go from the Greenwood Leflore Hospital. It is about maybe 50% of the staff remaining there because in order to be, you know, offer emergency surgery, I mean, emergency room, you have to have
Hmm.
so many doctors and nurses available for that because you've got goes it's around the clock, so you have to have doctors and nurses on duty whether you
Yeah.
have one patient or 50 patients.
Right. What about some back office staff? Has there been any opportunity to shrink those ranks as well?
Correct, and they're also even renting some of the facility to some other doctors in some other
Okay.
clinics.
To produce revenue.
That's been right, and they're also. I got a note this morning that they were also restructuring the hospitalist service with potential for some ICU beds. So
Okay.
that hasn't happened yet. But like I said, swing bed revenue opportunity. They're dealing with that. So they're pursuing what they can pursue with the to keep the revenue and the services for the citizens.
I
Absolutely.
know. I know Medicaid expansion. You have last time you and I talked. You mentioned the high amount of uninsured services provided by the hospital, just unreimbursed. You get some assistance from the federal government, what they call disproportionate share payments, that offset some of that, but it's certainly not equivalent to if you were to be fully reimbursed by Medicaid, Medicare, or private insurance. Has anybody done an analysis? I know I may have asked you this the last time, that says, okay, if Medicaid were expanded, this is what our financial picture would look like historically. If we just took a year, the past fiscal year,
Right.
and said, this is the way it would look had Medicaid expansion been in place. Is that exercise ever been done?
Well, I don't know if they've given us numbers to that effect. I'm sure that the hospital administrators have those numbers,
Yeah.
but I've never seen those. But I know we've talked about it in all of our meetings. Nobody's given a specific number, but they've just said that, we've lost so much money by not receiving the
Yeah.
Medicaid expansion. And they just said that, like I said before, even the critical access would not fix the entire problem, but it would certainly go a long way. Well, so would the expansion of Medicaid.
Yeah, Medicaid. Yeah. So I believe
Yeah.
you're on record, as are others, as saying, yeah, this isn't a single solution that would resolve this financial problem, but it would provide some assistance, especially if you've got a large number of patients as part of the patient census who would qualify, and you would be reimbursed on that basis.
Absolutely. And, we wouldn't be really in this critical of a situation if we had had some Medicaid help. I mean, we really
Okay.
would not. But not saying that we would be out and be in the
Yeah.
black, but I'm just saying it would have gone a long way. And
Gotcha.
now cities are just being challenged every way you look for different fundings, just like with PERS. All of a sudden, the
Yep.
cities are now going to be challenged with that, and that is a huge challenge,
Yep.
Gerard. That we're
We
going to
had
have to figure
Mayor
out how
Barker
the
on
world-
yesterday. We're out of
Yes.
time, Mayor,
I-
but really appreciate you coming on
Okay.
and talking about this. We'll talk
Thank
some
you
more.
so
Thank you,
much.
ma'am.
Thank y'all.
Appreciate it.
Thank you
Yes,
so
ma'am.
much. Have a great
We're
day.
coming right back. You too.